Are there any things that you think that people have been asking both of you that you think we should share?
I think the big thing that isn't being talked about right now about the media is the great recovery rate for this. And so it's actually, although it sounds very scary and it's a virus, we're not talking about the fact that most people will recover. And so we don't talk about the fact that this actually is a disease for most healthy adults and for children that is easy to recover from if we take good precautions and we look after ourselves and we keep hydrated and we contact the health professionals when we need to. It's actually got a great outcome.
In fact, so far of the cases that we've had in New Zealand, only one has been in hospital, and that was someone who unfortunately was in a more vulnerable position. So I think that does prove that point.
I guess the other thing people say is, it's no worse than the flu. In some ways, it doesn't really matter. So it is a bit worse than a bad flu. But it's not as scary as something like SARS or Ebola. So we should deal with it in the same way as a bad flu, and all these things that we're doing will prevent bad flus.
Immunisation protects against diseases in the same way. It gives your immune system a practice run with a broken up or weakened germ, so it won't give you the disease. Your body learns how to recognise those germs and is ready to fight them off before they can make you sick. You may get a fever or a headache after you are given a vaccine. This is a common response to the vaccine and should pass quickly. If you're worried at any time, talk with your doctor or nurse. Once you've been immunised, if you come across the same germ again, your body will remember it and fight off the germ before you get sick. This is how immunisation protects against disease.